Hello everyone, and welcome to A Holistic Approach to Healing the Gut. I'm Dr. Adam Seay. Many of you are watching this video and you may have a gut issue that's going undetected, or no one can really put their finger on as to what's happening, but you're struggling day in and day out, or you may actually have a diagnosed gut condition and want to find a better way or an alternative to what you're currently doing. I'm hoping this video will expose more holistic ways that we can help improve that issue and get your gut to heal naturally. Just a little bit about myself. I am a board certified chiropractic physician in North Carolina. I have been in private practice since 2005, and my practice focuses on applied kinesiology. We also focus on functional neurology and also functional medicine. In this video, I will discuss how the gut barrier system breaks down the 4 R's and how you can heal the gut naturally. The gut comprises the small and large intestine, and the gut's barrier system is located in the small intestine. This is where your absorption occurs. So you kind of have, almost, if you can think of an analogy like a screen window or a screen door, nice days outside, you open the screen window or you open the screen door to allow air to come in, keeps the bugs out. The small intestine is very similar, allows your small particles of nutrients to be absorbed directly into your bloodstream. Larger food particles then move on to the large intestine to be discarded as waste. This barrier system can break down, so it's like someone coming in, put a nice gash in your screen window or screen door by multiple different components, and we'll go over what those are. And this breakdown is actually called leaky gut syndrome. So leaky gut syndrome is caused by several things. It can be stress, and who doesn't have stress? Everybody that walks on the planet has stress. It can also be caused by antibiotics. If you watch our other video, you'll know more about what antibiotics do, which is also depletes the body of diamine oxidase, which is what helps break down histamine in your body, and again, another contributor to breaking that intestinal barrier system. NSAIDs will also do it. These are your non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, aspirin. Infection will do that as well. So it could be a gut infection, could be a virus, could be a parasite, could be yeast, fungus, mold. All of those have the ability of breaking down that barrier system. We see alcohol and caffeine will do this. Food allergens also will do it. And oral contraceptives. So this kind of looks at that leaky gut syndrome. So you can have antibodies, you can have dietary proteins or peptides come through. Any physical stress, cytokines, drugs, xenobiotics, infections, enzymes, neurotransmitters, all these things, if this barrier system becomes breached, if it gets leaky and inflamed, now those things are actually passing directly in to the bloodstream. So your bloodstream's right here. So once that happens, your immune system has to identify what these things are. So if we kind of think of the gut as separate from the rest of the body in that it's its own system. So you have a lot of the blood supply is used to seeing nutrients drop in, but when you get larger food particles or enzymes or infections or other antibodies coming in that the immune system does not recognize, it's going to respond to that. So then what we see is this intestinal barrier dysfunction breaks down. We see food allergy and intolerance start to occur in people. And then we also see immune system abnormalities. And eventually, if it goes undetected, it can't even turn on to autoimmunity. So this is where we're seeing positive ANAs, positive rheumatoid factors, but the person isn't autoimmune yet. That's because we're getting this immune system going a little haywire to things that it should not be responding to. So leaky gut syndrome causes a host of problems, but the major ones include Crohn's disease. You see ulcerative colitis with it. A lot of times we see headaches, migraines. You can see asthma, wheezing, runny noses. You can also see chronic fatigue syndrome, autoimmunity. We also see a lot of nutrient deficiencies as well. Celiac is usually a big one that most people associate with nutrient absorption and deficiencies. We also see irritable bowel syndrome. You can have dermatitis, eczema, acne, hives, skin rashes. We also see an insulin insensitivity, or what we call like insulin resistance. We also see PCOS, which is polycystic ovarian syndrome. It usually is where, again, insulin resistance is happening, causing testosterone to go really high for women and making it very difficult for fertility. We also see weight gain and edema can happen as a result of this, depression, anxiety, mental fog, and we also see fatigue mentally. And we also see fibromyalgia, a big one, and joint pain. So how do you heal a leaky gut? Well, we're going to talk about the 4 R's, and the 4 R's stand for remove, replace, repair, and re-inoculate. So we want to remove any infective organisms. So this could be pathogenic bacteria, this could be parasites, this could be viruses, it could be yeast, fungus, mold, and going back to bacteria could even actually be not necessarily pathogenic, sometimes opportunistic as well, or you could have an overgrowth of your own flora in a region that's not supposed to be. You want to also remove any other irritants as well, toxins being a part of that. You also want to remove any food allergens or any dietary triggers that your body may be responding to. The next step we want to do is to replace. We've got to replace digestive enzymes to get digestion better, and we have to get hydrochloric acid back in as well, because that's going to break down your food, allow you to absorb more nutrients from it, keep that barrier system intact. And then the next one we want to do is repair. We have to repair the damage that's happened at the intestinal lining. And then the last one is to reinoculate. We're going to have to put good bacteria back into the intestines so that it competes with the bad bacteria and other organisms that are in there. It's estimated anywhere from 10 to 100 trillion organisms exist in our gut. So let's discuss how I test in my office for leaky gut. We usually start with comprehensive blood chemistry, and we do look at a lot of different things because it gives us the best snapshot of what's happening to you at this moment. We want to do a CBC with differential and platelets. We want to do a complete or a comprehensive metabolic panel, which is 14 different analytes, looking at your electrolytes, your kidney function, liver function, blood sugar. We also look at your C-reactive protein, which is cardiovascular specific for inflammation. Homocysteine, kind of another inflammatory marker, looking at your ability to methylate. We also look at a hemoglobin A1C, which is a 90-day snapshot of your blood sugars. We also look at vitamin D, looking at parts of the immune system with that. Uric acid, kind of telling us your fructose intake, but also an inflammatory marker. Magnesium, GGT, phosphorus. We look at a complete iron panel, and we also do a complete thyroid panel. Another one that we do look at, which is a clotting factor, which is fibrinogen. Again, we want to get a baseline of what's happening. Going back to the thyroid, we just don't run TSH and T4. We do the whole thing, free T3, free T4, total T3, total T4. We do the reverse T3, the free thyroxine index, the T3 uptake, and we check the antibodies. And this is vital. If you have not had your antibodies checked, this is a must to screen for Hashimoto's. And in some cases, we will look at ammonia for people getting a better idea of what's happening in their methylation cycle. Another one that we do is an intestinal barrier system test. And you can do this either through blood or urine. We use a couple of different labs. The first one looks at diamine oxidase. We'd mentioned that a little bit. Again, this is the enzyme that breaks down histamine. You can have an issue here from a genetic standpoint where you have what's called a single nucleotide polymorphism at this particular enzyme. And if you do, you're not going to break histamine down correctly. We also look at histamine, and they also take the ratio of diamine oxidase to histamine, and they look at lipopolysaccharides as well. And this is done through Dunwoody Labs, and this is the blood test, or a blood test. Another one you can look at is occludin, zonulin, and lipopolysaccharide antibodies. It's just done by Cyrex, and they do a phenomenal job of that. This is also a blood test. And the lactulose and mannitol test done by Genova Diagnostics, which this is a urine test looking at malabsorption that is happening in any breach in that intestinal barrier system. The other thing, again, that we'd mentioned, we do look at is genetic testing, because this is at the heart of everything. Because if you're struggling, that means you've done a lot of things and just not getting any better. So this is usually the big missing piece of the puzzle that a lot of doctors miss. They don't go into the genetics. This is a salivary test. What it looks at is multiple different SNPs. Again, those are single nucleotide polymorphisms that you have, just misspellings in your genetic code. And it'll look at your methionine cycle or your methylation cycle. It'll look at your neurotransmitter cycle, your urea cycle, your folic acid cycle, looks at your ability to detoxify, just a whole host of different things it tests. And it's really an inexpensive test today. I mean, it's crazy. 23andMe is who we usually do for that one, and you just order the kit straight from them online. We also do look at a bacterial overgrowth breath test, and a lot of people have gut issues, and it appears that leaky gut is linked into this as well, which is what's known as small intestinal bacterial overgrowth. This particular test tests for the presence of that using lactulose to see how much methionine and hydrogen gas are produced from consuming that amount of lactulose. So this is done by Genova Diagnostics. Again, this is where we see a lot of joint pain, a lot of nausea, fatigue, bloating, distension, all those things that people struggle with gut problems. Can even be some of the bacteria from your large intestine getting into the small intestine from the ileocecal valve, having some dysfunction there. So again, we want to work on that aspect for people, and we also want to get the nerve supply in there better as well. A stool microbial. What we look at here is analyzing your beneficial bacteria, your opportunistic, and your pathogenic bacteria to let us know what your probiotic status looks like. Are there opportunistic bacteria that are present, or is there a bad bacteria that's in there that we need to eradicate? It also looks at parasites, and it also tests yeast, fungus, mold. And again, we do this, Genova Diagnostics does this one. We also want to look at food sensitivity testing, because this is paramount, because we want to know what foods your body is capable or compatible with consuming. So it does test multiple different foods. You can go into food additives and preservatives. You can look at spices. You can also look at any pharmaceutical agents that the body may be reacting to, again, whether it's an antibiotic or a non-steroidal anti-inflammatory drug. A couple of companies that we use for this, ELISA Act is one that does a very good job looking at the lymphocyte response. Genova does an antibody screen, and ALCAT also does a very good functional test to give us a good idea of what foods you're going to be compatible with consuming so that it does not trigger an immune response. Another great test is the NutriVal. This one is the first morning void. It's a urine test. Multiple different factors that it looks at. They do an organic acid profile, testing your ability to detoxify, your need for B vitamins. Dysbiosis is also tested. So several different things that they test just in the organic acid, which is a phenomenal test. They'll look at amino acids also. This again plays a role kind of into the genetic aspect as well. They will look at your fatty acid analysis to see if you need omega-3, 6, 9, 7, see what actually is needed for your body. They do an elemental analysis, looking at some heavy metals, looking at some mineral content. And they will test for oxidative stress. Again, where is the body being stressed from a standpoint of the cellular level? And again, Genova Diagnostics does this one. We also, in my office, use clinical kinesiology. This tells us a lot. We use this in combination with the lab testing, because we want to test several different points. There's a whole host of tests, points that we test in addition to this, but we usually want to muscle test the small intestine, the large intestine. We want to look at your allergy point to see, is there a potential allergen that is an issue? We want to look at your toxin point to see, are you stuck in your ability to detoxify? We want to check the stomach, the gallbladder, the liver, the pancreas, and we want to screen for any infective organism that may be there too, in addition to what your lab tests are showing us. So again, most of these are our acupuncture points that kind of give us an insight as to what your body's dealing with. So let's discuss my approach to a leaky gut syndrome. What I do, again, we combine lab testing, clinical kinesiology, and we use brain-based therapies to heal the gut. Because again, we can't get anywhere if we get the inflammation down and get all of that better and the nerves aren't firing into the gut to keep the gut healthy. So again, we have to address the brain. Your 10th cranial nerve controls everything from your brainstem all the way down to your belly button. So that one is vital. It's called the vagus nerve. So if your vagus nerve's not firing correctly, we've got to get that one stimulated correctly so that your gut will perform and actually heal and prevent anything else from reoccurring. I use only natural and effective protocols aimed at healing the gut. I also incorporate dietary changes, nutritional supplements, cold laser, we do detoxification, chiropractic, again this is vital, and brain rehab, again another vital component, because structure rules function. So if we again put the fire out with inflammation, we got to rebuild you so that your body performs better, your gut performs better. So again, we'll come back to the 4 R's again and look at that. So removal. Again, you want to remove pathogens. Some things that we use in the office, we're going to use neem sometimes. And again, we test each person as to what their body's compatible with. Berbermycin, we may use silver, we may use chaga, we may use another product called ProBoost, Paratocin, Idalia, which is a ozonated oil. We may use Key 5, which are different herbs that are targeted for viruses, virescents. We may use the Byron White formulas. Again, your body will kind of show us what it wants to combat any pathogens that we find. We also want to clear out toxins. We do that several different ways. We can use the OmniCleanse program. We have a detox foot bath through the EB Pro that works very well to kind of start that process of clearing out toxins. We can use the detox renewal kit from Zymogen. We can also use their OptiCleanse, their i5, and vitamin C is a very, very powerful detoxifier, especially on the gut. It can get a lot of flushing to happen as well. And again, this is a very important component to detoxing metals too. It's a very good one. We use Potent Sea Guard from Perk for that. Food allergens and triggers. Again, we want to look at any food sensitivities that you have. DesBio actually has some homeopathics, and we do use homeopathics out through each one of these steps as well. But they have some food sensitivity kits that you can take to kind of reprogram the body not to be sensitive. Helps to move through that process a little faster. Usually we want to pull people off of gluten, dairy, and soy because even if they don't test with this, that's where we usually start people, and a couple other things that really are hard on the gut. So again, we got to remove those triggers and allow that gut to heal. And you definitely want to follow any food testing guidelines that was comes back through testing to allow your gut to heal. We also want to replace, again, digestive enzymes. Some of the ones that we use in the office: Premier Digest. We may use Zymozyme, Digestase, Panzyme pH. There's multiple different enzymes that we can use. A lot of times, again, we test your body for what it responds to. Hydrochloric acid, and this is another one we have to get back up. This is a great lymphatic mover for us as well. Disinfects your food, so again, to prevent any bacteria or other pathogens from coming back in food, you got to have adequate amounts of HCl. So we use Premier HCl. You can use gastracid. Glutalamine is a great one for those that can't quite handle hydrochloric acid. Great on soothing the stomach. If you've been on proton pump inhibitors, for a long time, you're going to have a rebound effect trying to come off of those. Glutalamine can work very well on that rebound effect as you're trying to come off of those if you are deciding to do that. And Gastrovin, another one too. If you can't quite handle HCl, sometimes we use Gastrovin and have the person steep it as a tea before their meal. Soothes the stomach. A lot of times they can tolerate HCl after the meal. The repair process, again, we want to use multiple different gut formulas in our office. We can use glutalamine, again, glutamine, aloe, very good on healing the intestinal barrier. Intestinal Restore is a great one. His-DAO, again, if you have an issue with diamine oxidase, we want to supply diamine oxidase to you so you can convert that over. I5, we may use GI Restore, we may use IgG. Again, all of these things are great on healing the gut. To re-inoculate, you're going to use probiotics, not just any type of probiotic. You want a pretty hefty dose of it. Probiomax Daily DF or Probiomax Plus DF and Probiomax DF. These are just different formulations that we use, but each one's unique and they do work very well. Saccharomyces can work very well. Boulardii, very good. Therabiotic Complete, another great multi-species probiotic. You also want to do prebiotics as well. So a lot of these formulations can contain some of these. It's going to be your arabdogalactin, your fructooligosaccharides, your inulin. Those things can be helpful. Again, we test you as to what your body responds well, because not everybody responds the same way. Leaky gut syndrome can be healed, but it's going to take time, it's going to take effort, and the right person to guide you through that journey. Since this is a very complex problem and you've probably been struggling with it for a long time, do not tackle this on your own. I can help you with this. If you are serious about putting an end to your poor health and starting on a path to optimal well-being, please give us a call. Give my office a call, and on a scale from 1 to 10 as to how committed you are, please, we want you to be about an 8 to 10, because this takes a lot of energy, takes a lot of effort, and you have to have what we call your want to fixed. And if your want to isn't fixed, then we really don't get too far. So again, an 8 to 10 is going to be to have actually the best outcome. If you mention this video, you will receive an evaluation and a report of findings for $60. And if you decide to purchase additional treatment, you have the legal right to change your mind within 3 days and receive a full refund. Federal plans are excluded from this, and this is a $200 value. I want to thank you for watching this video. And again, if you're serious about getting this taken care of, call my office today at 919-662-0520. We look forward to helping you on your journey to better health. Thank you.